What actually happens at a hospice admission? In this video, I'm going to take you through step by step what should happen at a hospice admission. I'm going to specifically talk about the admission process in this video, but I just want you to know that the referral process, you usually get a referral from your doctor. However, I want you to take note that you do not have to. If you or someone you love, if you think they might be appropriate for hospice, you can always self-refer, so just know that. Also, for hospice admission, sometimes the hospice nurse will do the hospice admission, sometimes the hospice social worker will do the admission, and sometimes a hospice liaison will have you sign paperwork and stuff before you actually get to the admission. Please know that it will vary depending on what agency you end up going with. So the hospice admission, when I go into a patient's house and I'm the hospice nurse going in for the admission, I usually will have been able to look you up in our computer system to have an idea about what's been going on. Some nurses get that information, some nurses don't. If you don't, the things you're gonna go off of are just basically the diagnosis that you get from the doctor or from the referral. And then when they arrive, they'll start asking you questions about the diagnosis and other things that have been going on health-wise in your life. Now, if you're me, the nurse who already has that information, I usually try to look it up and write it down in my notebook. So when I get there, I have a good picture of what's been going on with you. And then not just your terminal diagnosis about why you're coming onto hospice, but I'll also know other health conditions that you might have. So at the admission, the important part is me, the hospice nurse, making sure that you're appropriate for hospice. So you're not necessarily getting approved at that admission. Me, the hospice nurse, be doing an evaluation to make sure you're actually appropriate for hospice. So not every hospice admission that I go to am I admitting for sure that patient onto hospice, because they may actually not be appropriate. I have to look at their diagnosis, talk about it with the doctor, get all of the information, and that person either meets the criteria to be on hospice or does not. And the other part of that is you, the person who's coming onto hospice, or your family member or loved one who's helping you, has to make sure that's what you want. So the whole idea of this admission is to make sure we're both on the same page and that I answer all your questions and you answer all my questions to see if it's a good fit. So when I'm doing a hospice admission, I always explain exactly what hospice is. To me, hospice is about living. Most people think it's about dying. I think it's about living. I try to explain to you how hospice works. Hospice is a Medicare funded program, meaning all hospices nationwide in America should be basically functioning the same. And Medicare is our boss. So I explain to you what Medicare says we are allowed to provide to you, the patient who's coming onto hospice. So basically Medicare says, hey, we're gonna give you this whole hospice benefit over here. You get all of these things, which I'll get into in a second, but because you're signing up for this benefit, which is technically free through Medicare or your insurance, you will lose some things over here. And this is the thing I'll get into too. So what do you gain from hospice? You gain a hospice company that is going to be available to you 24/7. So a nurse cannot be in your house 24/7 usually, but we are available to you, meaning you can call us 24 hours a day, 7 days a week, and we can talk to you about what's going on, and we can send a nurse out to you if need be. So at 2 in the morning, if you call us because your loved one suddenly is confused or suddenly has more pain, you call us and a nurse can come out. Also, what we give to you over here is a team of people. So the team, this is generally speaking, the hospice doctor, hospice nurse, hospice social worker, hospice chaplain, hospice certified nursing assistant, the CNA, and there are other people part of the team. There's volunteers sometimes, there's physical therapy sometimes, there's music therapists sometimes, it just depends. So that team of people is going to be your team, your helpers now. And they will be visiting you week by week. So standard number of nursing visits. So the lowest amount we would be there would be once a week. Once a week, the nurse would come out and check on you. Now, if you're having a great week, they're gonna come in and they'll see you once a week and they'll see you next week. So it's once a week standard. Now, if things are going wrong, you're having issues, you're having a bad week, medication's not working, they can come up to every day if they need to, right? We can escalate care depending on what your symptoms are. These are all the things that I'm going to be explaining to you at a hospice admission. The social worker and the chaplain are two huge parts of the team that I feel like are underutilized by the family. One, a family hears the word chaplain and they're either turned off because they feel like they're not religious or because they have their own priest or chaplain that they work with their church, which is totally fine if they want to just use their priest or pastor or chaplain at their church. But also this person, the chaplain, is a trained professional to help with emotional and spiritual issues that you might have during your end of life process. And I feel like they're really underutilized. So please know that they're not there to try to convert you to a specific religion. They're truly there just to support you and your family. So please utilize them. The hospice social worker can help with all types of things. Family dynamics, financial issues, to name the two things that I feel like come up the most. But I just feel like the social worker can be underutilized as well. If you ever are unhappy with how the care is going or how your brother is acting when he comes over, you can always utilize the hospice social worker to plan a family meeting to help you guys get organized and address issues that haven't been addressed. Also with that team, this hospice benefit that you get over here if you sign up for hospice, you will receive supplies, which I'll go into later on in this video. So you'll get supplies from us. You'll get equipment from us, which again, I'll go into detail later on in this video. Medications from us. Again, I'll go into detail later on in this video. All of these things are included in this hospice benefit. Now over here, things you lose if you sign up for hospice. I hate using that word lose. I want to make a clear distinction here. If you sign up for hospice, you do lose part of your benefits. So the things you can't do on hospice, you cannot receive chemo or radiation for your terminal, usually it's cancer. Terminal cancer, you're usually on chemo and radiation, but now you're gonna be stopping treatment and you're gonna go on to hospice. So you can't do both. Now I will say every once in a while, someone will still continue to receive radiation because it's a palliative treatment. So it's basically radiation or chemo to help shrink down a tumor or something to make you feel better. So that kind of stuff you still can do. But if it's anything that's quote unquote curative, you cannot do. You are no longer supposed to go into the hospital. So if you called 911 and went into the hospital while on hospice, if you got admitted into the hospital, you would automatically be taken off hospice. You can't do both. So that is something you quote unquote lose. Now, when I'm at an admission, this is literally what I'm saying to the people that I admit. I say all of what I'm saying now to them. And I always say, you're not stuck at home. You don't have to stay on hospice. If something, like God forbid, you fall and break your arm, we are going to say, go to the hospital, get your arm fixed. And then you can always come back to hospice if you choose. But in general, the whole point of being on hospice is so you don't have to go to the hospital, so you don't have to continue to do that. And there's many things we can do over here, like we'll still start antibiotics if we think you have an infection. If you're starting to have new symptoms, we will treat those symptoms. So there's a lot of things we can still do for you over here. After I say that whole spiel to the patients and family that I'm working with, I usually get their opinion, see if this is what they thought it was going to be, if this is what they want. If they say yes, and it's a good fit, and I think they are appropriate for hospice, and I've talked to the doctor and all the things, then we'll sign paperwork. You have to sign this paperwork because, like I said, it's a Medicare federally funded program. And in order for me to actually check you out and do a medical assessment at that visit, I have to have the paperwork signed. So we'll go through all the paperwork, we'll get that signed, I'll leave you guys copies. And then once that's signed, you're technically officially on hospice. So now I'm the nurse that's first there at the admission. So I can do the full physical assessment. We can review all of your medications. I can order new medications if I think I need to, and I can order supplies and equipment. So that's the next part of the admission. Now, if you haven't noticed, this actually takes a while, right? So usually admissions will take up to 2 hours because there's a lot of stuff to review, and hopefully you have a lot of questions that I can answer for you. So during the assessment, I personally do a full head to toe assessment. So head to toe assessment, I'm listening to lungs, I'm listening to heart rate, I'm checking all the vitals, I'm checking out your hands, your toes, I'm doing a neurological assessment, everything. I'm doing all the works. I'm checking out the skin head to toe to make sure there's no hidden wounds anywhere, because those are common at at the end of life to start getting pressure sores, just because the skin's an organ too, right? So the skin's shutting down as well. So I'll do a full head to toe assessment. I'll have you take out every single medication you're on, even over the counter medication. So if you're taking a lot of Tylenol or you're taking vitamins, every medication you're on, even if it's as needed, I have you bring it all out and we review it all. I also go over the medications with the doctor, and we will hand pick what we think you should stay on, what we think you should be off of. It's also up to the patient. If the patient is like, I am sick of taking all this medication, we will work with you to not have to take the medication. We always advise to continue medication that's helping with symptoms. So if you were on the pill, the drug Lasix, right? Lasix is gonna help you with edema and make you probably feel a little better. So if you stop just suddenly taking that medicine just because you don't want to, you might actually start feeling worse. So anything that I think is going to help with your symptoms or help with your daily living, I will always encourage you to stay on. But of course, I'm going to take your word for it. And if you're not into taking the meds, I'll listen to you. We always try to take off vitamins, always try to take off cholesterol medicine. Blood thinners are a little iffy. You have to weigh the risk versus benefit, because right now you're at risk for falling. And if you're on blood thinners, you could bleed. So it just depends. But at this admission, we will be going over all of that. Then I'm gonna listen to what your main symptoms are. Do you feel like they're being managed? Is your shortness of breath okay? Is your pain okay? If it is, we're gonna keep everything as is. If it's not, I'm gonna call the doctor and we're gonna work it out and get new things ordered. This is also the time when I'm going to be ordering the comfort pack. I've talked about the comfort pack in other videos of mine, so if you're curious about that, you can look there. Most all hospice companies will order something called the comfort pack, which has just in case medications in it. So I'll order that for you. And all of the medications should be delivered. You do not have to go to the pharmacy any longer. So we can deliver all the medications for you. Also, please take note that you can still continue to have a primary care doctor. You will have a hospice doctor, but you still can keep your primary care doctor if you choose. If you don't and don't have a relationship with a primary care doctor, that's okay too. The other things I'm going to order at this visit: equipment. I'm going to talk to you as the patient and the family about what you think you need, and I'm going to be checking out your house to make sure it looks safe to me. So I usually will ask like what rooms you're usually in, and then I'll be checking out if I think it appears safe or not. You don't want loose rugs around because falls are a huge issue at the end of life, so you don't want loose rugs. You want to have like lights on, or at least like some light in the middle of the night, just in case they're walking back and forth to the bathroom. I think it's important to have equipment there. It's easier to care for someone if equipment's there. So the things we normally order are like a bedside commode, a shower chair, a hospital bed. We can order a Hoyer lift if we need to. That's if someone's bed bound. That will really help. Wheelchairs, walkers, all types of things. So we can order those things for you. So you just work with us and we'll order as much or as little as you need. This is also the time where we can order oxygen if we need to. I do think oxygen is over ordered, just side note, but we can do it there. Now, supplies. Every company is going to be different, but Medicare basically says what we are allowed to order and what we aren't allowed to order. I usually order stuff like gloves, bed pads, wipes, briefs, lotions, creams, anything for wound care if that person needs. Now, if the person already has like a Foley catheter or an ostomy bag, or they already have a wound, we can order all of that stuff as well. So all of those things will be supplied through us. Now, things we don't do or don't order are things like PureWicks. PureWicks are like it's like the new catheter for women. We don't order things like that. But if families really want it, you also can pay for that out of pocket yourself. But we don't order specialty items on hospice, unfortunately. After I'm done ordering all of these things, I will of course ask you if you have any questions. I always try to do that during the admission, but I also, before I leave, ask, do you have any more questions? I know I hit you with a lot today. Anything that I haven't gone over that you want to go over? If I haven't talked to the family about what code status they are, meaning like, are they full code or are they DNR, or do they have mortuary plans? I always try to feel out those things to see how prepared people are. I always say something like, we all have an end of life journey, and we know through the diagnosis that you have that yours is soon-ish. We don't know when. Is it 6 months? Is it 8 months? Is it 3 months? We don't really know. But what I do know is the more we can prepare you, the better things will go. So do you have any questions about that? Do you want to know what to expect? My point in saying all this is because I say it like that, that gives the patient and the family an opportunity to ask hard questions. 9 times out of 10, people are happy that someone's finally talking about it. Although it can feel uncomfortable, it's always good to talk about what to truly expect with your specific disease. If your hospice nurse is not doing that, which they probably will because that's what we do, but if they're not, you can always ask that. You can always say, what can I expect specifically with my disease? What symptoms can I expect, if any? And how can you help with those? Also, if you have a lot of questions while I'm saying all of this to you, I have another video that talks about the questions you can ask your hospice company during this admission time. So that can help you too. So that's it. That's what you can expect at a hospice admission. Please feel free, if you're experiencing this, to ask all the questions you want to ask during that hospice admission. And I always remind people that at the end of the day, all you have to do is remember to call us. Remember to call us if you need anything. We are here to support you. So you are officially signed on to hospice. You will start seeing your team in the following days. And please just remember to call us if you need anything.